But it's time now for Uncancelled. And this is where Britain's top commentators speak out on controversial issues without the fear of the cancel culture sweeping the rest of the media. Now, despite mask wearing being confined these days to just the scared and neurotic, the theatre of face muscles is still enforced across most healthcare settings across the UK. But our next guest is tackling the final bastion of COVID ridiculousness head-on with a campaign to get masks scrapped from hospitals, dentists and other medical venues. Dr. Gary Sidley, a retired NHS consultant clinical psychologist, is part of the Smile Free campaign against forced masking in the UK, a movement backed by over 7,000 signatories of an open letter to NHS bosses that includes scientists, health professionals and patients. He argues there is a lack of robust scientific evidence to support wearing face nappies, and they in fact do more harm than good by impairing communication, re-traumatising victims of sexual and physical abuse, and giving elderly folk even bigger risks of falls and confusion. Dr. Sidley, great to have you here. Is there any justification to continue this mask-wearing madness?
No, I struggle to see any, Dan. All the robust evidence points in one direction, that masks are ineffective in any setting, and there's a whole range of harms associated with them. As you've already said, in healthcare, there are some specific damages that are problematic in healthcare, like impaired communication. If people can't hear what's being said and there's no non-verbal communication, that's always bad. The doctor struggles to understand the problem. The patient struggles to understand the solution. Elderly people are disadvantaged with their hard of hearing, their confusion on many occasions. All that is exacerbated, and they are heavy attenders at our health settings. People with emotional problems from traumatic abuse, sexual and physical abuse in the past are particularly triggered by masks, and they again are regular visitors to healthcare settings. So no, there isn't any justification. There's no rational basis for it. It should stop immediately. And our campaign at Smile Free has put together an open letter to the chief executives of NHS England, NHS Wales, NHS Scotland, NHS Northern Ireland, basically urging them to remove the mask requirement with immediate effect. And as you said, we've already had 7,000 plus signatures, a whole range of people, including professionals, over 1,700 professionals, doctors, surgeons, consultants, frontline nursing staff, many more. So there's a lot of momentum behind this, Dan.
Well, indeed, and I don't want to get your hopes up, but the Daily Skeptic website, which is this brilliant website run by Toby Young, has reported tonight that the requirement for healthcare workers to wear face masks in clinical settings is to be dropped by NHS Trust from Monday. Now, that's according to a source within the health service, but they said they're not sure whether all trusts will make this change at the same time. But it seems like maybe you're already making a bit of a difference, Dr. Sidley.
Well, maybe our campaign has already had an impact.
Well, let's see. If that is true,
that is tremendous news, Dan. Absolutely.
Well, let's hope so. Because, if you want to wear a mask, fine. If you want to wear a mask, fine. But no one should be forced to. No one should be forced to. Dr. Gary Sidley, thank you so much.
If your many tens of thousands of viewers want to sign our letter, they can do so.
Oh, yes, where can we do it?
smilefree.org/NHS.
Great stuff, Dr. Gary Sidley. Thank you so much. The retired NHS consultant, clinical psychologist, and the man behind the Smile Free anti-mask mandate campaign, which may well be working already. Time will tell.